A small gland in your neck plays a powerful part in the body. It secretes and regulates hormones and influences many of the body's important functions. Dr. Tilak Mallik with People's Health joins us now to talk about the thyroid health and how it could really throw everything off balance. Thank you so much for joining us.
Thank you, Nancy, for inviting me.
Yeah, well, this is a personal issue for me because back in 2009, I had half my thyroid removed. I had thyroid nodules, and they thought it could have been thyroid cancer. Luckily, it wasn't. But I mean, this is a typical or pretty common thing, isn't it, for people to have? It
is, absolutely. And as we advance, we see more and more diagnoses. The fortunate part of it that now the technology has advanced so much that we can make those diagnoses much easier than 20, 30 years ago.
Well, tell me what the thyroid is. There I am going to surgery, but what's the thyroid and how does it work?
There's a small gland at the base of your neck, just over your sternum. This small, powerful gland, it controls from head to toe. You think about it's there. From mentation, from regulating your heart rate, for your lung function, gut function, and as well as your skin. The beautiful skin that everybody fights for. If your thyroid is in trouble, you have a dry, coarse skin, hair loss, and all kinds of stuff. On the other hand, so then the most important thing for you would be to understand what are the most common thyroid disorder that we face day to day.
So what are they?
Hypothyroidism, the word hypo means low, capabilities of producing thyroid hormone, and hyper, when it is too much. What's the most common part of the hypothyroidism? Obviously, mentation becomes slow, skin becomes dry, hair is coarse, loss of hair, dry skin, and sometimes you get a puffiness around your eye, around your body. Lower part swells up, but it is not a pitting edema that you normally see in a congestive heart failure. It's a non-pitting edema.
So if you're gaining weight all of a sudden and you can't explain it, or your hair starts to fall out or thins out, or you have all these dry skin symptoms, okay, what do you do? Where do you go?
Obviously, first time you see your primary care. So, doc, I need help. And at that particular time, he's going to do some basic testing, and he will then select out patients that need to be referred to a doctor like us, endocrine doctors. And then we do further testing to categorize which type of disease she is having.
So the drug can help every day. You have to take a drug every day if you have this condition. And also, different foods you can eat maybe would help.
Absolutely, iron-containing food, but the beauty of it that nationally we have already added iodine in the salt, so you really don't have to look around. And what you need to do, avoid food, tofu, cabbage, those sometimes can interfere. Some drugs like lithium that sometimes can interfere. But if you're not involved in that, then most of the time, once a diagnosis is made, you are doing great with it.
And quickly, Dr. Mallik, I saw on Facebook the other day, someone was concerned that dental x-rays could be like maybe spark thyroid cancer. Could that be true?
In the sense that we have so far not given that much attention to it, but it appears each time you go to a dentist, there is an x-ray. So what I suggest to my patient, ask for a cover, a lead cover, each time they're going to go. It's a good idea to do that.
All right, Dr. Tilak Mallik, thank you so much for joining us, and a lot of great information that, of course, I knew a lot of it myself. Thanks a lot.